As you know, Riverside launched our transformation to a culture of safety in 2011. Together, we've accomplished a lot, including reducing our rate of serious safety events by over 50%. While we are and should be proud of this, we still have much work to do on our journey to zero events of harm. While changing culture is hard, it is our culture that determines how we behave, and it is our behaviors which determine how our patients fare during their Riverside episodes of care. One patient who is harmed while in our care is one too many.
Please, we're asking you to take the time right now to focus on this short video. It will make Riverside a safer place for our patients, our residents, and our team members. We will work in high-risk situations that increase the chance we will make an error. We're under intense pressure, sometimes hurried, often fatigued. We can avoid most errors by practicing these low-risk behaviors. You're already familiar with them. They're contained in the Team Up for Safety Toolkit. Tools such as using three-way readbacks and repeatbacks for ensuring clear communication, and using the STAR technique to prevent those skill-based errors. So for the next 20 minutes or so, we will role model these behaviors. Our intention is that by giving you a clear demonstration, it may help you adopt these behaviors and tools and use them even more often and more effectively. Thank you for your close attention to this video. Let's work together to memorize and practice these simple safety tips for the sake of our fellow team members, our patients, and our residents.
Behaviors you're about to see are expectations, no matter what your role in Riverside Health System. Welcome to Safety Culture 101. Our goal today is to enhance our culture of patient safety and to examine how each of us can contribute to a safer patient experience. First, we will define our 5 safety behaviors and the error prevention tools that support each of those behaviors. Then, we'll examine ways to apply these error prevention tools. We will analyze some common medical errors and then examine the need for peer cross-checking and coaching. Finally, we'll examine the value of physician leadership as it applies to patient safety, and we'll look at the idea of power distance. The safety behaviors we will discuss today are: practice and accept a questioning attitude, communicate clearly, hand off effectively, pay attention to detail, and be accountable. Each of these safety behaviors has at least one error prevention tool designed to help avoid lapses in safety. This video will demonstrate how these tools, when used consistently and effectively, will improve patient safety throughout our health system. Let's talk about our first safety behavior: practice and accept a questioning attitude. Our main tool to practice this behavior is stop, reflect, and resolve. This is really an internal mechanism or self-check when something doesn't fit with your expectations, what you know and expect to be true. The most important step is to stop in the face of uncertainty by listening to your reflect detector and then do whatever it takes to resolve your concern. Remember, it's okay not to know, but it's not okay not to find out. Let's see what happens when a question of safety comes up in a practice setting.
Dr. Burgess, do you want any pre-op antibiotics on this patient?
Yeah, let's give her a gram of penicillin if she's not allergic to it.
I'll check on that. Dr. Burgess, it looks like she does have an allergy to penicillin.
In that case, let's give her 80 milligrams of gentamicin, please.
80 milligrams gentamicin.
That is correct.
Will do.
Our point here has been to introduce the idea of practicing and accepting a questioning attitude, which has enabled our nurse to speak up to the doctor. It is important to note that both sides have a responsibility here. Practicing a questioning attitude means speaking up when you have a concern, but just as important is the acceptance of the questions. When the doctor tries to shut down the question, he is risking patient safety. Our next safety behavior is to communicate clearly. In order to help us communicate clearly, we have adopted several error prevention tools: IS-Q for the transfer of information, three-way repeatbacks, three-way readbacks, asking clarifying questions, phonetic and numeric clarifications for sound-alike numbers and words, For the IS-BAR-Q tool, remember the following. IS-BAR-Q stands for I, introduction, who are you or who are you talking about? S, situation, what's the immediate problem or the bottom line? B, background, the review of the pertinent information. A, assessment, I think the problem is, or my assessment is. R, recommendation, what's your recommendation, a request of the other person. And finally, Q, questions. Do you have any questions about the information that has been communicated?
Hi, Dr. Gasink. I know you're covering for Dr. Ward. This is Rebecca on the skilled unit. I'm calling about Mr. Bloom. He's a patient here. He had a hip fracture. He was discharged from the hospital. 3 days ago, I think. He had a hip fracture, and he's on Coumadin, I think.
It doesn't take long to recognize that our nurse seems frazzled and her verbal report is disorganized. Has she taken a moment to think it through, to write it down, to describe the situation, give the background, offer an assessment, and make a recommendation? It might have gone more like this.
Hi, Dr. Gasink. This is Rebecca on the skilled unit. I have a situation. Mr. Bloom fell out of bed 15 minutes ago. Unfortunately, I left his bed rails down while I was emptying his bedpan. He doesn't have any signs of injury right now. He is a little lethargic. His background is that he's a patient of Dr. Ward's. He had an ORIF for a hip fracture a week ago, and he came to us on the unit 3 days ago. An hour before he fell out of bed, he was given 4 milligrams of oral Dilaudid for pain. My assessment is that there's no evidence of injury right now, but he may be lethargic from the Dilaudid that he received. I'm recommending that your nurse practitioner maybe evaluate him for the drowsiness and that we get an INR. Just observe, do neurochecks every hour. Any other recommendations or questions?
Clearly, the IS-BAR-Q format helped our nurse organize her thoughts and is a model for all of us as we strive to communicate clearly and to hand off effectively. Now, let's see how a three-way repeat back works. First, the sender initiates the communication. The recipient must acknowledge the communication with a repeat back, and then the sender must acknowledge the accuracy by saying, "That's correct," one of our key safety phrases.
Hello, this is Dr. Gasink.
Excuse me, Dr. Gasink. The potassium on Mr. Smith is 4.2.
Mr. Smith, potassium 4.2.
That's correct.
That's how it works. And now, a three-way readback.
Hello, skilled unit, this is Rebecca. Hi, Dr. Gasink. I just wanted to let you know that the hemoglobin on Mr. Smith is 8.2.
You know what? Let me write that down.
And his hematocrit is 24. That's 2.4.
Mr. Smith, the hemoglobin is 8.2 and the hematocrit is 24. That's 2.4.
That's correct.
This is the patient's baseline, so no orders at the moment. Thanks so much for calling.
Another important tool for communicating clearly is the clarifying question. This technique ensures that you don't make an incorrect assumption.
I have a clarifying question about Mr. Harris. The family had mentioned that he's allergic to penicillin. Did you mean to prescribe Keflex? I know there can be cross-reactivity between the two.
Yes, I meant to order Keflex. I clarified with Mr. Harris's family that his allergy to penicillin was minimal and that he had Keflex in the past and tolerated it without difficulty. Thanks for the clarifying question.
Phonetic clarification is used during verbal communication when words sound alike. It is often helpful to use phonetic clarification for drug names and for patient names.
Is this Mr. Brent or Print?
This is Mr. Donald Brent. That's B as in boy.
B as in Bravo, Brent.
For sound-alike numbers, use numeric clarification. Say the number and articulate each digit. 15 and 50 can sound alike.
Was that 15, that's 1-5, or was that 50, that's 5-0?
For For a complex number such as 425, articulate each digit, 425. In addition, the number such as 425 can sound like a range of 4 to 5. Therefore, we want to insert the word dash for ranges. It works like this. That's the range, 4-5. For our next safety behavior, handoff effectively, we'd like to focus on the 5P handoff tool. Within our health system, patients must routinely move between facilities and between providers. Nationwide, poor transitions of care are one of the main sources of medical errors. At Riverside, we can turn this into a strength by consistently using the 5Ps. Let's watch how this works.
This is Ms. Elizabeth Taylor. She's a patient of Dr. Cavitt's. The plan is to transport her to CT to have a CT scan to rule out PE, as she's been having chest pain and shortness of breath. She does need to stay on the cardiac monitor. She is also a fall risk secondary to medications. She has been given nitro and morphine for her chest pain.
All right, just to clarify, I'd like to repeat back. This is Ms. Elizabeth Taylor, Dr. Cavitt's patient. She needs to go to CT to rule out pulmonary embolism. She has chest pain and shortness of breath and will need a cardiac monitor. She's also an increased fall risk due to the morphine and nitro she's received. Is that correct?
Yes, that is correct.
Ms. Taylor, my name's Desiree. We're going to take you over to CT, and we're going to take great care of you today.
Thank you.
We need to take extra precautions when patients transition from one facility to another. Here's an innovative way that Riverside Tappahannock Hospital and The Orchard are assuring that an effective handoff occurs.
As patients move from caregiver to caregiver and provider to provider, it's critical that information about their treatment goes with them. Either within the hospital or during a transfer to another department or facility, this patient transfer or handoff is a critical moment, and if not handled efficiently, vital information about a patient's health may be misunderstood. This is why Riverside Health System has implemented the 5 Ps: patient information, plan of care, purpose and desired outcome, precautions, and problems. Here is an example of the 5 Ps implemented between 2 Riverside affiliates.
This is Mr. Brown and his daughters Amber and Kelly. Did you get the 5P that I faxed?
Yes, I have it ready.
Okay, a little patient information. This is Mr. Joe Brown, 60-year-old white male who came to us on the 2nd and had a left total knee replacement. He has an allergy to latex. Did you see that?
I do see that. I'm going to read that back to you. He's got an allergy to latex.
That's correct. Do you have any questions, Charlotte?
No, it sounds like it's complete. Thank you.
Okay, they'll be bringing him over, so expect him around 11:30.
Okay, sounds good. We'll see you when you get here.
Thank you, Charlotte.
Thank you.
Thank you.
All right.
Have a good day.
The 5 Ps is an effective and efficient process that helps the Riverside Health System ensure clear communication during patient handoffs.
The 5P handoff process is not meant to be a burden. Use it where it's appropriate, such as change in shift, a change in level of care, or a transfer to another Riverside facility. Our patients depend on us to do this. Let's now talk about the safety behavior of paying attention to detail. The error prevention tool we have adopted to help us pay attention to detail is a mnemonic called STAR. This is meant to reduce the honest, skill-based errors that are so easy to make. S stands for stop. Pause for 1 to 2 seconds. Think. Think about what you intend to do. Act. Perform your task. And finally, review. Check that you obtained the desired result.
Hey Sarah, is this hemoglobin correct on this patient?
Let me just finish what I'm doing and I'll be right with you.
Okay, thank you.
Yeah, that patient's hemoglobin didn't come up after the last 2 units of blood.
Okay, great. Thank you.
You're welcome.
Mr. Smith, we're ready for you. Mr. Smith. Mr. Smith.
Oh, you go ahead.
All right, thanks.
Good afternoon, Mr. Smith.
Good afternoon.
How are you today?
Good. You?
Good, thank you. Please have a seat right here.
Okay. Sure.
Could I please have your full name and your date of birth?
John William Smith, June 1st, 1970.
Could you please repeat the date of birth?
June 1st, 1970.
It looks like we have you mixed up with another John Smith. This happens more frequently than you think. This is why we double check your birthday. So if you give me a minute, I will go get the corrected chart, okay?
That makes me feel much better.
Good.
Our final safety behavior is be accountable. In this behavior, we look out for one another by taking responsibility for our own safe behaviors and supporting and sometimes critiquing our peers and coworkers to ensure a safe patient experience. Let's look at one of our tools that supports accountability. Speak up for safety using our CUSS words. The acronym CUSS stands for concerned, uncomfortable, and stop, and is used to escalate a situation. Remember, you don't need to be right, you just need to be concerned. Our patients and their families are trusting you to follow through on that concern until you're certain that they are safe.
Closing up here, we'll be done here in about 5 minutes or so.
Okay. I'm concerned I'm missing a pair of pickups.
Definitely not up here. Look on the floor and the drapes.
I've looked on the floor. It's not there.
My hands are in the abdomen, and I know it's not in here.
We've lost a pair of pickups, and I don't feel comfortable moving forward with the procedure.
I think we should just continue. We're about done.
We're going to need to take an x-ray.
Listen, I don't want to waste an hour waiting for X-ray to get here to take a plain film to confirm that there's no instrument left inside her belly.
We need to stop the procedure. It's very important that the count is correct, and it's not. We need to stop the procedure and take an x-ray.
You're right. Thank you for speaking up. Call the X-ray tech and see if we can get him in here to do a quick X-ray.
Can you call an x-ray, please?
Being accountable to patients and families means speaking up when you have a concern. Part of that accountability is using cuss words in the appropriate situation. Our point here has been to introduce the idea of practicing and accepting a questioning attitude, which has enabled our nurse to speak up to the doctor. It is important to note that both sides have a responsibility here. When practicing a questioning attitude leads one to voice a concern, not only does that individual need to speak up, but the question must be accepted. It is just as important that the doctor accepts the nurse's questioning attitude. When he tries to shut down the question, he is risking patient safety. We use the words concerned, uncomfortable, and stop to make sure that we are taking any safety concern seriously. And remember, we're always to practice and accept a questioning attitude. It is important that the physician recognize the value of the cross-check and accept the nurse's questions, not as a personal attack, but in the best interests of the patient.
Safety is the singularly most important thing we do. If we can't do it safely, we're not going to do it at all. We are counting on all of you to stay the course, to help our commitment to turn the Team Up for Safety behaviors into real habits that protect our patients. These behaviors and tools set clear expectations for every member of the Riverside Health System team. Regardless of your role, our patients can only be protected when we all make these habits our own.